Aging brings wisdom, perspective, and often health challenges. One of the most overlooked truths in senior health is this: our nutritional needs change dramatically after 60. What worked for you in your 40s or 50s may no longer be enough, or worse, it may start doing more harm than good. And nowhere is this more evident than in the world of vitamins. Today, we're focusing on three key vitamins that every person over 60 should understand, not just because they are essential, but because when taken incorrectly, they can quietly chip away at your well being. Let's begin with one of the most misunderstood vitamins of all: vitamin D. Vitamin D is often called the sunshine vitamin because our skin produces it when exposed to sunlight. But here's the problem: as we age, our skin becomes less efficient at converting sunlight into vitamin D, and many older adults spend less time outside, either due to mobility issues or simply being cautious of skin damage. The result? A silent epidemic of vitamin D deficiency in older adults, and most don't even know it. Low levels of vitamin D are linked to a higher risk of bone fractures, muscle weakness, depression, cognitive decline, and even increased risk of heart disease. This is not a small issue, it's foundational. Your bones, brain, and immune system all rely on this nutrient. So, how much do you need? For most adults over 60, the recommended daily amount is around 800 to 1000 IU. But here's where caution is crucial. Taking high dose vitamin D supplements without medical supervision can lead to toxicity. And that's not a scare tactic. Excess vitamin D can cause calcium to build up in your blood, leading to nausea, kidney problems, and confusion. If you're already taking a multivitamin or separate calcium supplement, you might be doubling up on vitamin D without realizing it. This is why reviewing your full supplement list with a healthcare provider is non negotiable. Next, let's turn our attention to vitamin B12, a vitamin that plays a critical role in brain function, nerve health, and red blood cell production. After age 60, the ability to absorb B12 from food drops significantly. Why? Because our stomach produces less acid, and stomach acid is necessary to extract B12 from food sources like meat, eggs, and dairy. The signs of a B12 deficiency are subtle but serious: fatigue, memory lapses, numbness or tingling in the hands and feet, and even mood changes. Left unchecked, it can mimic dementia. That's how powerful and potentially dangerous a B12 deficiency can be in older adults. Most seniors benefit from a B12 supplement, often in the form of sublingual tablets or even injections for those with severe deficiencies. Fortunately, B12 is water soluble, meaning the body excretes what it doesn't use, so it's relatively safe. But don't assume more is always better. Oversupplementation can sometimes mask other health issues, and it's essential to monitor your levels with a blood test. If you're watching this and thinking, I've been feeling more tired lately, or my memory isn't what it used to be, it might be time to ask your doctor about checking your B12. If this resonates with you, leave a comment and share your experience. It helps others realize they're not alone. And now, let's talk about a vitamin that many seniors take, often without knowing the full picture: calcium. Calcium is essential for strong bones. We all know that. And yet, the way we supplement calcium in older adults has led to controversy and unintended consequences. After menopause, women in particular are at higher risk of osteoporosis. Men are affected too, though often later in life. Calcium, along with vitamin D, is critical to prevent bone thinning. But here's the risk: calcium supplements have been linked to an increased risk of cardiovascular events, particularly when taken in high doses. Calcium from food sources like dairy, leafy greens, and fortified plant milks is generally safer and more bioavailable. Supplements, however, especially when taken in large amounts, can lead to calcium buildup in the arteries. So, how much calcium is enough? Most seniors need around 1,000 to 1,200 milligrams daily. But unless your diet is very low in calcium rich foods, a supplement may not be necessary, or at least not a full dose one. In fact, taking just what's needed to fill the gap is safer than more is better. It's not about avoiding these vitamins, it's about understanding them. Vitamin D, B12, and calcium can each dramatically improve quality of life after 60, but they must be approached with respect, knowledge, and individualized care. What makes all this more complicated is the supplement industry itself. With thousands of products marketed directly to older adults, often with vague claims like supports healthy aging or boosts vitality, it's easy to assume that more vitamins mean better health. But health doesn't come from blind supplementation. It comes from precision, purpose, and partnership with a qualified health provider. You deserve better than guesswork. You deserve guidance grounded in science, shaped by experience, and delivered with care. For seniors, the real challenge lies in how these nutrients interact with other aspects of life, particularly medications, chronic conditions, and changes in how the body absorbs nutrients over time. Let's begin with something critically important but often overlooked: how vitamins interact with prescription medications. Many people over 60 take multiple medications for blood pressure, diabetes, cholesterol, heart rhythm, mood, or pain. This is common and often necessary, but each of those medications can impact how your body processes certain vitamins, and vice versa. For example, long-term use of metformin, a common diabetes medication, is known to deplete vitamin B12. Studies have shown that people taking metformin for years can have significantly lower B12 levels, which may go unnoticed unless specifically tested. Similarly, proton pump inhibitors, PPIs, medications like omeprazole for acid reflux, reduce stomach acid. That sounds helpful for heartburn, but it also means the body struggles to absorb B12, iron, and even magnesium. The longer you're on acid blockers, the higher your risk of nutrient depletion, particularly if you're already eating less or have a limited diet. Now, consider blood pressure medications, especially thiazide diuretics like hydrochlorothiazide. These can increase calcium levels in the blood, which, when combined with calcium supplements, could lead to an overload. This isn't just about the kidneys having to work harder, it's also about your arteries becoming more vulnerable to calcification. In older adults, that's a real cardiovascular risk. Even over the counter medications like aspirin can affect nutrient levels. Chronic aspirin use may lower folate and vitamin C levels, subtly influencing immune function and energy levels over time. This is why supplementing without medical oversight can be dangerous. You may be doing everything right, taking vitamins daily, eating well, staying active, and still facing unseen deficiencies or toxicities because of how those vitamins interact with your medications. Now let's go deeper into how aging changes nutrient absorption. This is one of the most profound shifts that happens after 60, and yet it's rarely explained clearly. As we age, the digestive system becomes less efficient. The stomach produces less hydrochloric acid. The pancreas slows enzyme production. The lining of the intestines becomes less responsive. All of this affects how vitamins are broken down and absorbed. This is particularly significant for fat-soluble vitamins, such as vitamins A, D, E, and K. These require healthy bile and fat digestion to be absorbed properly. But if you've had your gallbladder removed, or if you suffer from chronic digestive conditions like IBS, celiac disease, or pancreatic insufficiency, your absorption of these nutrients may be impaired. Even seemingly minor issues like dry mouth, reduced appetite, or trouble chewing can impact nutrient intake and, over time, create deficiencies that are mistaken for something else, like fatigue, poor balance, or memory trouble. This is where regular blood work becomes invaluable. A simple annual check can reveal levels of vitamin D, B12, folate, calcium, magnesium, and more. It's not about chasing perfection. It's about catching silent problems before they turn into serious ones. Let's briefly return to vitamin D because there's a nuance that often goes unspoken. Many people take vitamin D without considering vitamin K2. While vitamin D helps you absorb calcium, vitamin K2 helps direct that calcium into the bones and keep it out of the arteries. Without K2, there's a risk that calcium ends up where it doesn't belong. And this is especially relevant for seniors already dealing with vascular stiffness, high blood pressure, or atherosclerosis. Emerging research suggests that combining vitamin D3 with vitamin K2 may offer a safer, more effective approach to bone and heart health. But again, this is not a one-size-fits-all recommendation. It depends on your existing conditions, medications, and blood markers. This brings us to a central principle in senior nutrition. Context is everything. Let's take a moment to talk about supplement quality. Not all vitamins are created equal. In many countries, supplements are poorly regulated. You could be taking a daily multivitamin that contains low-quality poorly absorbed forms of nutrients, or worse, one that contains unsafe fillers, binders, or even contaminants like heavy metals. For example, calcium carbonate, a common form of calcium in low cost supplements, is harder for aging bodies to absorb than calcium citrate. Similarly, synthetic forms of vitamin E, often listed as DL alpha tocopherol, are less beneficial than natural mixed tocopherols. These distinctions matter, especially when your digestive efficiency is already reduced. Whenever possible, choose supplements that are third party tested by organizations like USP, NSF, or Consumer Lab. Look for transparency in labeling, and ideally, consult with a pharmacist or licensed health provider who understands geriatric nutrition. There's also an emotional side to this discussion that's often ignored. Many older adults feel overwhelmed by all the pills, vitamins, medications, herbal extracts, and start to wonder, what's really helping me? If you've ever felt this way, you're not alone. Pill fatigue is real, and it's okay to step back and reevaluate. A thoughtful, streamlined supplement routine is often more effective and certainly safer than taking a handful of pills just because they're marketed as anti-aging or vitality boosters. If you've ever cleaned out your supplement cabinet and wondered if you're doing more harm than good, that's a sign of wisdom. You're asking the right questions. The truth is, your body needs fewer things, but it needs them done right. By now, we've established that vitamin D, B-Mojave, and calcium are three of the most essential and misunderstood nutrients for older adults. But knowing which vitamins to focus on is just the beginning. The next step is learning how to recognize the subtle and sometimes surprising signs that your body is either lacking these nutrients or getting too much. Let's begin with vitamin D deficiency, which is disturbingly common among older adults, especially those living in northern climates, spending little time outdoors, or dealing with chronic health conditions. Early signs of low vitamin D can be so subtle, they're often blamed on just getting older. These include low mood, persistent fatigue, generalized muscle aches, and a feeling of physical heaviness or sluggishness. Some people experience frequent colds, slow wound healing, or even increased falls due to weakened muscle coordination. These aren't just inconveniences, they're red flags. Left unchecked, severe vitamin D deficiency can accelerate bone loss, increase fracture risk, and may even contribute to cognitive decline. Inflammation levels rise and immune defenses drop. For an older adult, this can turn a minor illness into a major setback. On the flip side, excess vitamin D, usually from taking high-dose supplements without supervision, can result in vitamin D toxicity, a rare but serious condition. Symptoms include nausea, vomiting, constipation, confusion, and in extreme cases, kidney damage from high calcium levels in the blood. This is why you must never assume more is better. A blood test is the only reliable way to determine your true vitamin D status, and from there, a precise dose can be chosen. Whether it's 800 IU, 100 IU, 2000 IU, or a physician-prescribed therapeutic dose, the goal is always balance, not guesswork. Now let's shift to vitamin B12, another vitamin that often goes under the radar. The tricky part about B12 deficiency is that it develops slowly. Symptoms creep in over time, and they can masquerade as normal aging, depression, or even dementia. Key warning signs include persistent fatigue, shortness of breath, tingling or numbness in the hands and feet, unsteady walking, mood swings, poor memory, and even mild paranoia or confusion in advanced cases. Because B12 plays such a vital role in nerve function, long-term deficiency can lead to irreversible nerve damage if not corrected in time. That's not meant to scare you, it's meant to empower you. The earlier it's caught, the easier it is to treat. A simple blood test can confirm your B12 levels, and for many seniors, a supplement, often sublingual or chewable for better absorption, is enough. In more severe cases, monthly injections may be recommended. The important thing is to monitor your levels regularly, especially if you're taking medications like metformin or PPIs, or if you follow a mostly plant-based diet. And now, calcium. You've heard it's good for bones, and that's true. But what you may not know is that both too little and too much calcium can cause significant health issues. Low calcium levels can cause muscle cramps, brittle nails, abnormal heart rhythms, and even confusion or hallucinations in extreme deficiency. Bone density slowly weakens, and in women post-menopause, this often leads to silent vertebral fractures, small breaks in the spine that go unnoticed until back pain or loss of height becomes noticeable. But too much calcium, especially from supplements rather than food, can lead to kidney stones, constipation, abdominal pain, and possibly increased risk of heart attack, especially in those with existing heart disease. Here's the good news: you can meet most of your calcium needs through your diet. Fortified plant milks, leafy greens like kale or collards, almonds, tofu, and low fat dairy are all excellent sources. Supplements should only be used to fill the gap, not to replace nutrition from real food. If you're already eating a balanced diet, taking a full 1,200 milligrams calcium supplement on top of that can easily push you into excess. Your doctor can help calculate how much you're actually getting from food and whether a partial dose supplement makes more sense. Now, what does vitamin overload actually feel like? The symptoms are often vague, but they add up. Headaches, fatigue, nausea, irritability, sleep problems, and digestive upset may all be signs that your supplement routine needs adjusting. Don't ignore them. Your body is always talking to you. The question is whether you're listening. Let's talk briefly about absorption enhancers and blockers. Natural factors that either help or hinder your body's ability to absorb nutrients effectively. For example, vitamin D absorption improves when taken with a meal that contains some fat, such as olive oil, avocado, or nuts. Similarly, calcium citrate can be taken with or without food, but calcium carbonate needs stomach acid and should be taken with meals for best results. But here's a blocker many people forget: caffeine. Drinking coffee or tea with or immediately after your supplements can inhibit the absorption of calcium, iron, and even B vitamins. It doesn't mean you have to give up coffee. Just space it out. Wait at least 1 hour before or after taking your vitamins. Also, alcohol, even in moderate amounts, can reduce absorption of B12, folate, and zinc, while increasing the need for antioxidants like vitamin C and E. If you enjoy an occasional drink, be sure your nutrition is strong enough to support it. Let's return to a crucial truth. Your body doesn't operate in silos. Vitamins don't work in isolation. They interact with each other and with your food, medications, and lifestyle. Taking care of your health after 60 isn't about following a generic supplement plan. It's about understanding how all these pieces fit together and making informed, personalized choices. This is the foundation of nutritional intelligence, the skill of feeding your body with intention, not assumption. Let's bring everything together now, not just for understanding, but for meaningful action. You already know which 3 vitamins are most crucial: vitamin D, vitamin B12, and calcium. You've also learned how aging, medication, and lifestyle can change how your body absorbs, uses, or loses these vital nutrients. Now it's time to ask, what should I actually do? How can you build a supplement plan that is safe, effective, and personalized without confusion, excess, or risk? It starts with one principle: test before you supplement. This means asking your doctor to run routine blood tests for vitamin D, B12, calcium, and folate, ideally once a year or more often if you're managing chronic illness or taking medications that affect nutrient absorption. These tests are not expensive, but the clarity they give you is invaluable. They replace guesswork with facts. If your results are optimal, you may not need supplements at all. If they're low, the right dose can be precisely calculated. No more playing nutritional roulette. If this resonates with you, leave a comment and share your experience. Has testing ever revealed a hidden deficiency you didn't expect? Once your lab results are in, here's how you build a safe, effective plan. 1. Prioritize food first. No pill replaces a nourishing, balanced diet. Whenever possible, aim to meet your basic needs for calcium, magnesium, vitamin C, and trace minerals through whole foods, especially plant-based sources, legumes, seeds, leafy greens, and fermented dairy if tolerated. This approach doesn't just supply vitamins, it provides fiber, phytonutrients, and enzymes that support total body wellness. Number 2, choose only the supplements you truly need. For most seniors, that often means a small handful. A vitamin D3 supplement, ideally combined with K2, especially if you're not consuming fermented foods. Methylated B12 in sublingual or chewable form, particularly if you're over 65 taking metformin or acid blockers or following a vegetarian diet. A calcium citrate supplement, only if you're not getting enough through your meals, and never exceeding the total recommended daily intake from all sources. Remember, adding more vitamins does not automatically make you healthier. In fact, the more supplements you take, the more interactions and absorption conflicts you risk. Number three, respect timing and combinations. As we've discussed, some vitamins compete with others. Iron and calcium, for example, should not be taken together. Calcium is best absorbed in smaller doses, no more than 500 to 600 milligrams at a time. Vitamin D is better absorbed with fat-containing meals. And as we mentioned, caffeine can interfere with multiple nutrients, so don't wash down your supplements with coffee or tea. 4. Stay consistent, but not rigid. Health is not about perfection. If you forget a dose here and there, don't stress. Your body is resilient. What matters most is overall consistency. Take your supplements at the same time each day, with meals if indicated, and store them where you'll see them, such as near your toothbrush or morning tea. 5. Review your supplement routine every 6 to 12 months. Our needs change as we age. A vitamin you needed 5 years ago might be unnecessary now, or a medication you've recently started might increase your need for B12 or magnesium. Make it a habit to review your current supplement list with your doctor, pharmacist, or qualified health provider every year, ideally alongside your latest lab results. 6. Watch your body's signals. No one knows your body better than you. If you notice changes, good or bad, since starting a vitamin, pay attention. More energy, better sleep, reduced brain fog, those are good signs. But if you feel bloated, nauseated, or more anxious, or if new aches appear, consider whether your supplements are contributing. Sometimes it's not the nutrient itself, but the added fillers, dyes, or binding agents that cause trouble. Number 7. Don't follow trends. Follow your needs. Health fads will come and go. You'll hear about super antioxidants, anti-aging cocktails, miracle herbs. But longevity doesn't come from chasing trends. It comes from understanding your body, meeting its needs with care and precision, and removing what doesn't serve you. There's a powerful peace that comes with this level of clarity. You're no longer guessing. You're no longer overwhelmed by the noise of marketing. You're making confident, evidence-based choices rooted in wisdom and self-respect. That's what it means to age with agency. And here's something else. You are allowed to ask for help. Aging can be beautiful, but it's also complex. You deserve support, not confusion. Don't hesitate to speak with your healthcare team about your concerns. Bring your supplements with you. Ask the hard questions. Say, is this still right for me? That single question could save you years of unnecessary fatigue, joint pain, or brain fog. Let's not forget the emotional side of all this. For many older adults, the daily routine of taking supplements can feel like a quiet act of self-care or a reminder of vulnerability. It's okay to feel both. But your health journey doesn't have to be isolating. When you take the time to understand your needs, listen to your body, and make informed choices, you're reclaiming control. You're honoring your future. And that's something worth celebrating.